The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us we have well-known periodontist, board certified, Dr. Stephen Brown. Dr. Brown, welcome to the program.
Thanks for having me, Randy.
Now, before we get into today's topic, I guess this is a big topic.
It certainly is.
Dental implants have become mainstream, as you say.
They have not only become mainstream, they've become predictable, they've become long-lasting, and they've become life-changing.
Now, when you say predictable, they don't fall out. Is that what we're talking about?
Indeed. We have over 40 years of experience now with dental implants. What I tell my patients is, if an implant survives a year, and better than 95% of them do, it'll last the rest of your life.
So what is a periodontist? We'll start there.
Well, a periodontist is somebody who deals in treating periodontal disease, which in fact is the largest cause of tooth loss in the world. And in fact, more recently, we've learned that the periodontal disease often has relationships to other systemic diseases, such as heart disease, stroke, premature babies, and a whole host of other things that we've learned. So periodontists are uniquely trained to do that, but more importantly, they are uniquely trained to do dental implants because they understand all of the tissues that are involved, meaning we understand how bone reacts to an implant, we understand how soft tissue reacts, and what's important to the patient is the ability for us to create something that is invisible.
So a lot could go wrong. We talked off camera in the hands of somebody inexperienced, because I guess any general dentist can do this. Is that right? This procedure?
Any general dentist can do it, and any oral surgeon can do it. We feel that the periodontist is uniquely qualified.
Biased, okay.
I'm biased, yes, uniquely qualified to do it. But in direct answer to your question, people who are unskilled can place implants. You know, what's important is the diagnosis, the treatment planning, knowing where and when and how to produce a successful result.
What are the different categories of dental implant patients you see?
Well, there's an entire spectrum of implant patients. The most common or the simplest would be a single tooth implant. This would be where somebody is missing one tooth and doesn't want to have their teeth cut down for bridges, and they choose a dental implant. If there were 3 implants or two teeth missing in a row, we can place 2 implants. Oftentimes, if we have to replace 3 teeth, we can do it with 1 implant on either side of a space and connect them. But one of the most rewarding types of implants are the kind that we give to patients who've been wearing dentures. Oftentimes, these patients have become what I call dental cripples. They are people who are unable to chew properly, they're unable to speak properly, they tend to cover their mouths very frequently, they don't like to smile, they don't like to laugh.
You say they don't know what they're missing.
They really
elaborate on that.
They really don't know what they're missing. When someone's worn a denture for a long time, they adapt to it. We all adapt to certain things. Our personalities are such that we learn to live with what we have. And after a while, one forgets what they've lost. They've lost the ability to feel food in their mouth because there's plastic against their palate. They've lost the ability to not have to chop up food into pieces so that they can eat it more readily.
So you say with only 2 implants that oftentimes people count their teeth and they rule themselves out. With 2 implants, you could secure a lower denture. Is that correct?
One of the biggest questions I get asked is, how many implants do I need? Well, I can absolutely alter a patient's life for good with as simple as 2 implants. Dentures have inherent ability to cause tissue to break down, meaning if somebody has worn a denture for a long period of time, they will lose a lot of their jawbone, the height and the width of their jawbone.
Why? Because no pressure on the bone, or what is it?
This is because there is pressure on the bone. Once a tooth is extracted, there's an 8-time more probability that there will be loss of bone structure than when teeth are in place supporting the bone. So if somebody's been wearing a denture for a long time, they've lost the bone height both vertically and horizontally, which is what gives them that sort of kind of
sunk in look.
Yes, it does.
Interesting.
And we could do more oftentimes than a plastic surgeon in giving somebody back their appearance just by giving them back their teeth, which restores the shape of their face, the height of their face, and gets rid of the wrinkles.
Now, you know, going into this interview, you know, my mother's 73 years old. She's been in dentures, she says, since she was 28 years old. She also informed me she's too old for dental implants, she says. Says her medical doctor told her that.
Let me tell you a story, Randy. I had a woman, we called her Mom Mom. She was 87 years old. Mom Mom was full of life, vibrant. She played cards every day. She went to the movies, etc. She did not want to have implants because she thought she couldn't have implants.
Okay.
We placed a number of implants in her mouth, and I can remember to this day as she hugged me at the end of the appointment, she said, "There's no stopping me now." And she marched off.
Why would an 87-year-old want to do this, though?
Well,
at that age.
She wants to be able to eat. She wants to be out in company socially. She wants to feel confident when she speaks and when she smiles and when she laughs.
Interesting.
Another story. I had an 86-year-old gentleman who on a Friday we placed 13 implants. And on Saturday, I had reason to go to my office with my son. We're driving in the car, cross street by my office, and who do I see walking across the street, arm in arm, dressed as natty as could be, this gentleman and his wife. You would think that nothing had happened the day before.
Yeah, so 87 years old.
87 years old.
And now how soon could he eat, by the way?
He could eat within days. I mean, in the beginning, certainly he's going to go with softer foods for a couple of days, but within a week's time, he was able to eat most everything, and within a month or two, there was no stopping him either.
So you say pain is not something they complain about?
In fact, it isn't. This is another myth that needs to be dispelled. If I were to pinch your skin, that would hurt.
Okay.
It hurts because there are nerve endings in your skin. But the jawbone is unique in that there are no nerves running through jawbone. So that if I make a small site in your jawbone by making a little penetration, there's absolutely no discomfort.
Interesting.
The patient only feels ever possibly the incision that's made in the gum. And that's a minor amount of discomfort. And today, we're even able to do implants without making any incisions at all.
You mentioned that's a misconception.
Yeah.
What other misconceptions are there about dental implants?
There are many misconceptions about dental implants. One of them is that an implant's a tooth. In fact, it isn't. When we lose a tooth, we've lost 20% of the tooth is what we see in the mouth.
Okay.
80% is what's in the jawbone, the root. What an implant is a man-made tooth root. Second common question that I ask, and misconception, is, am I going to reject this? And I have to explain to patients that there's a difference between a transplant, as in a kidney or a heart, and in an implant, which is, as I said, a man-made tooth root. I make the analogy to the pin that an orthopedic surgeon would put in bone to reinforce it. And in fact, an implant reinforces bone.
Now, another thing, that things have changed. In the old days, it could have taken a year for the process.
Indeed. How
has that changed?
I'm sorry. In the old days, the way in which it was done was we first would place the implant. If it was a lower, it had to be at least 3 months. And we couldn't put them when we took the teeth out. We couldn't place them when we took the teeth out. So consequently, the teeth were extracted, we waited several months, and then we placed the implants, and if it was a lower, we had to wait at least 3 months, according to the protocols that we used then. And if it was the upper, it was 6 months. So it easily could take a year to 18 months to do a complete case.
And now?
Today, we can place an implant in the same day, place a tooth on it, and the patient walks out of there with a new tooth.